Mr. Tesfaye.
ውድ ወላጆች እንኳን ደህና መጣችሁ። ሁሉንም ተሳታፊዎች በአማርኛ ለማዳመጥ እንዲቻል እባካችሁ በዙም ተጠቀሙ። ዙም ከከፈታችሁ በኋላ ከታች የምታዩትን የዓለም ቅርጽ ያለበትን ተጫኑ። ከዛም ጃፓኒዝ የሚለውን ክፈቱ። እንዲሁም ቢዩት ኦሪጂናል ኦዲዮ የሚለውን መደረጉን ያረጋግጡ። አመሰግናለሁ።
Thank you, Mr. Tesfaye, and thank you to our interpreters who are helping us provide interpretation services to our Amharic-speaking families this afternoon. Happy Friday, salam, and welcome to the ACPS reopening chat with the Habesha community. My name is Tanika Taylor Tukan, and I am the School Engagement and Community Outreach Manager for ACPS. We do want to thank everybody who is joining us on Zoom or on Facebook as we lift up the concerns that have been voiced by hundreds of comments and questions that parents have submitted across the week. We know there's a lot to discuss about the reopening of schools and that our time today is limited. So I want to introduce my co-moderator and colleague, Aiden Buba, with whom I've really enjoyed working to strengthen ACPS's relationship with the Habesha community over the past few years.
Thank you, Tanika. Thank you, everyone, for tuning in today. Like Tanika said, my name is Eden Buba, and I'm a teacher at T.C. Williams High School International Academy. And it's an honor to be here. We've been working hard to make sure that the Ethiopian and Eritrean community, which is a huge population, has the chance to share their thoughts and to ask questions. And one of the ways we've done that is through partnership with the Ethiopian and Eritrean Alliance, who we've been working with very closely as well. And we're really glad to be here with you guys. I know that everyone is working hard and has a lot of different thoughts about potential solutions for reopening schools. So we want to make sure that your questions are answered over the next 60 minutes. Please make sure that you guys are utilizing the chat and also the chat on Facebook as well. One of the things we want to make sure we're appreciative. Dr. Hutchings has really been a phenomenal leader. I say that with all sincerity, working so hard to make sure that safety is at the forefront, and all of the other school leadership team that's here on this line. I've seen firsthand with the cross-functioning teams for planning for reopening how dedicated everyone is. And I say that with all sincerity. So let's hear a few words before we move forward with the questions from Superintendent Dr. Hutchings.
Thank you so much, and Dana Nachu to our all of our viewers today. I just want to welcome you all to this wonderful Zoom session. And as our panelists or as our facilitators had mentioned earlier, you know, this is an opportunity for us to hear the voices of our families. And, you know, I think it's so important that we actually had sessions this time that related to people who speak other languages, such as Amharic, because I believe that your voice is powerful. And there are times where sometimes your voice is not being heard by central office, or sometimes your voice is just not as loud as others. And we want to make sure that everybody who is a member of the Alexandria City Public Schools community has a seat at the table to make change and to give insight. So I hope that you all will learn something today. I hope that we'll be able to answer all of your questions, and I'm looking forward to the wonderful discussion. Thank you.
Thank you again, Dr. Hutchings, and to all the ACPS staff who have joined us here today. We're going to do brief introductions so you guys know who's here representing our school division to answer your questions. So we have Dr. Stephen Wilkins, Chief of Staff, Dr. Terry Monzingo, Chief of Teaching, Learning, and Leadership. We have Dr. Gerald Mann, Executive Director of Instructional Support, Dr. Elizabeth Hoover, Chief Technology Officer, Dr. Marcia Jackson, Executive Director of Student Services, Dr. Alicia Hart, Acting Executive Director of Facilities and Operations, Terry Werner, Executive Director of Specialized Instruction, Erica Gulich, Director of Capital Programs, Planning and Design, and Daryl Sampson, Executive Director of Student Support Teams. Have I missed anyone there?
Well, Dr. Bethany Nickerson, who is the Executive Director of Language Access and English Language Learner Support Programs at ACPS, thank you for joining us. And I also didn't want to forget Mr. Tesfaye, who I named at the beginning of the session, but he is our division-wide Amharic speaking parent liaison and probably single-handedly responsible for inviting and making sure that most of the families who have joined us here today are here. So I want to thank him for not just the essential work that he did to connect families to this event, but throughout the year.
Thank you. So we've received a lot of questions, and we're very grateful for all of the families taking time to submit questions in advance. So we're going to try to dedicate blocks of time to really make sure that we're fielding all the questions that come in. And we have categorized the questions based on different topics. One of them, delivery and instruction, health and safety, and technology, communication, and engagement.
So thank you, Aiden, again for that. I do want to underscore one of the things that you just said, and that's that the topics and questions that are driving today's discussion are based on the hundreds of comments and questions that we receive from parents, either by text, by completing the online form, or by connecting with Mr. Tesfaye or the Ethiopian and Eritrean Alliance for Education throughout the week. And I think what we'll see throughout the chat today is that these topics really mirror what we learned from the reopening survey that was completed by so many of our parents a couple of weeks ago. The survey responses showed us without a doubt that students' physical health and safety was the top factor in decision-making for families, and that at the time, 64% of parents who completed the survey in Amharic preferred a fully virtual model, while 36% of those parents preferred a hybrid model with a mix of virtual and in-person learning for students. So we know ACPS is getting closer to making a decision on the model that will be observed when schools reopen. And we just want to thank all of the parents for their feedback that they've offered in so many ways leading up to that decision.
Thank you. So we're going to dive into the first topic, which is delivery and instruction. A few things to take note of. If you have additional questions, please post them in the Q&A box. Tesfaye and Tanika will be keeping an eye on the Q&A box, but also on the questions that are coming in through Facebook as well. And again, we only have an hour, so if there are any questions that don't get answered here, they will be answered, but you'd have to look for the FAQ during the community chats, which are going to be compiled as well. So we'll jump right in. So the first question, is there going to be a choice available, hybrid or virtual, for families? Will we get to decide which choice is better for their situation?
Great question. Again, you know, even though ACPS hasn't decided on a model, we've heard from so many parents around this idea of choice, parents who want to know if they'll be able to decide what is best for their child. And they've been hearing a lot of information from surrounding districts, right, that are giving parents enrollment options. And so naturally, our parents want to know if they'll have a similar say-so. I wonder if Dr. Mann or Dr. Mozingo can offer some insight into the models and what ACPS is considering around parent options.
Before they start, I wanted to say one quick thing before Dr. Mozingo begins. And that is, I think it's important for us as we're looking at both of the models, the 100% virtual as well as the hybrid models, we are determining what's feasible. So we're in an opportunity now where it really isn't about what choice or what is best or what's right and what's wrong. It's around what is feasible and allows us to stay within the Center for Disease Control or the CDC guidelines, and also that allows us to meet the constraints that we have, whether it's staffing or funding or, you know, ensuring that kids are 6 feet apart or transporting kids to and from school if we were to have an in-person option. And then also to make sure that we are living up to some of the input that our community as well as our staff members have given us in regards to reopening our schools. And then finally, it's really about if it's aligned with what we believe as a school division, meaning if it's aligned with our vision, our mission, and our core values of our newly adopted strategic plan. But the number one piece to all of this, before we even get into the constraints or the inputs or the vision, we have to look at the health and safety of our students and our staff members. But if Dr. Mozingo could just elaborate a little more on how that process is going to, to work in regards to, like, we're looking at the feasibility next week and what we've done thus far in regards to our models.
Good afternoon, everyone, and thank you so much for asking that question. I'm going to talk to you just briefly about, as he said, what has occurred to date and where we're actually going. First, we want to say that we are, as a school division, we're really committed to making sure, regardless of the model, that we provide quality instruction. What we've learned in our previous models is the real need to make sure that our teachers and our schools still continue to engage students, to still make sure that they are learning at high levels. We have teams that have been working, and the teams have been looking at, and no decision has been made, but they have been looking at what would instruction be like within a distance learning model, what is instruction like in a hybrid model. What I'm really pleased to share with you is that next Friday, we're going to be in a position to be able to share and propose to the community what the teams have been working on and what has been developed. At the end of the day, though, we want to make sure, and I've seen some of the just instructional strategies that are being proposed. We're going to make sure that there is an opportunity for engaging videos. We're going to make sure that there's an opportunity for pre-recorded lessons by teachers. We're going to set some real expectations on how much time should be spent with Zooming. We're going to provide expectations around office hours. I was able to meet with the team this morning, and I have to honestly tell the community that what some of our teachers are developing as instructional strategies going forward, there's a real commitment to a high level of engagement for all students and all learners. So there will be many more opportunities to make sure that our students are highly engaged. But our goal is our planning teams will be meeting next Monday and Wednesday, and next Friday we will be unveiling to the community a proposed model, and along with that, some instructional strategies.
Thank you for that response. As a follow-up question, a parent has asked, childcare will be a huge challenge for families. Whether we are in a totally virtual model or hybrid model, what are the plans in regards to childcare options for ACPS families? Is it in partnership with other organizations such as the Rec Centers or Capania Center?
Good afternoon. My name again is Dr. Alicia Hart, and I'll be able to address the childcare question. We are working with a number of our community partners to include Parks and Recreation, Campania, Casa Chiralagua, and others to determine what childcare options could be available for fall. And as those conversations are ongoing, we are doing our best to consider all of the particular scenarios, whether it is a hybrid model or a virtual model, to determine what type of options we can offer for before care and after care for our working families.
And I think one thing, just to add on to what Dr. Hart has said, there were a lot of lessons learned from March to June. You know, when we had to close our doors on March 13th, we overnight had to become a virtual school division. And everybody across the country was trying to figure out how to even function and operate remotely and out of, the brick and mortar of our schools. And some of the lessons that we learned from that is, during this time, from March to June, the governor had an executive order for everything to be closed. So many of our families, except for people who had jobs that were essential, personnel, many of our parents were home with their kids. This is going to be very different this fall because this isn't an executive order where everything in the Commonwealth of Virginia is closed. We're going to be choosing to do some virtual here, within our school division. And that means that other entities and other organizations and buildings and companies will be open and families are going to have to be at work, some parents. And that's a huge concern, especially if you have young children who cannot be home by themselves. And as Dr. Hart has mentioned, we are collaborating with our local childcare providers so that we can make sure that we're offering some options. So that's going to be very different than how it was with from March to June, where there really were no options. And a lot of that is because everything was closed at that time. We're going to be in a very different situation moving forward, and we're trying to be proactive to provide, just some options for some of our families who don't have a choice and will have to go back to work.
Thank you. Moving on to question number 2. The parent has asked, there must be a mechanism that allows students to earn grades as we move forward. The pass/no grade system did not work in the spring. How will that be different in the fall?
I'll take that question. So the one thing, as Dr. Hutchins just stated, with the shutdown that happened in the spring, the state said that we needed to take into account that we're in a pandemic and we didn't want to harm students. So students, if they were in good standing, were able to be promoted to the next grade or also graduate. And so there are certain provisions that were put in place across the state to allow, especially for seniors to graduate and students to earn credits. And so we worked as a leadership team to propose policy changes to our school board that went into effect to reflect the state changes, but we know that the Virginia Department of Education has also stated to school systems or divisions across the Commonwealth that school's back in session starting September 8th or whenever schools begin. So we know our grading policies will go back to somewhat normal, where students will earn grades. Elementary students will get more than introduced and not assessed on their progress reports. So we understand that there may have been some concerns with the grading practices that were put in place in the spring, but we will be moving back to a more traditional grading system and scale in September.
Thank you, Dr. Mann. The next question, a parent is asking, if ACPS is all virtual, what resources do you have for parents to help their children with school tasks? Will it be in Amharic?
So I'm going to ask Dr. Nickerson. Yes, good. I think she's good.
Thank you, Dr. Mozingo. Thank you for that question. ACPS develops all of its materials, information, and the website in English, and then translates the information into Amharic for families, and also into Spanish and Arabic. The website and ACPS Express are great resources to check where we share information. Our English learner teachers as well, who are working with our students, are also a good resource, and they can use Language Line to communicate in Amharic with our parents. We also have bilingual parent liaisons and our information line in Amharic. For the fall, we're also working on a guidance document that will include tips or recommendations for parents on how best to support their children with school tasks, and that will be translated into Amharic.
Thank you. The next question asks, what services will be offered to children with special needs, English learners, or advanced placement?
I'd be happy to answer the question regarding services for students with special needs. The Office of Specialized Instruction has ensured that every student with an IEP has continued to receive their special education services. We have the students' teachers, the students' case managers, as well as the related service providers working with those families in a virtual environment. While it is very clear that our first priority is student and staff safety, our second priority is to return students to school as soon as we can. As Dr. Hutchings mentioned, we are looking at the feasibility of multiple options. And one of those is the possibility of returning some school children to school. That may or may not be possible, but we are looking at all of our options. In the meantime, we have an extensive array of instructional strategies, materials, and programs. Special education teachers will work with children individually, they will work with them in small groups, and they will work with them in collaboration with the general education teachers to ensure they receive the services they need.
With respect to English learner services, after our school building closure in March, our English learner teachers at each school developed lists of students who they would reach out to each week to ensure students were understanding the classroom work and to assist if they were having any difficulties. The English learner teachers also worked very closely with classroom teachers to ensure the lessons that were being developed were accessible for our English learner students. In the fall, we will continue with both of those practices. Additionally, we will also have a dedicated time in the schedule for an English language development course.
Thank you. Dr. Mann or Dr. Mozingo, do you want to weigh in on any additional services that will be available for students who are in advanced placement classes or dual enrollment programs?
Yes, I'll take that one, Dr. Mozingo. So our plan is still to honor the requirements for advanced placement classes and dual enrollment. We know we have people working on the high school currently on aligning our work with Northern Virginia Community College on the requirements for dual enrollment courses, and then also our coordinator at the high school working with the College Board on advanced placement. And if people are wondering for services for our talented and gifted students, just for, as Dr. Nickerson described and Ms. Warner, around services for EL students and special education students, we will still ensure that our tag programming happens for those students at the elementary level, and then also honors classes, AP, DE classes at middle school and high school.
Great. Thank you. I see we do have a live question related to instructional delivery around, this parent says, we all know there's a great achievement gap between students. What will ACPS do to bridge those gaps and support families who are unable to provide their children with the support they need?
I can start off with that, and then I'll turn things over to our team. You know, one thing I think that is important for us to understand is that, you know, this achievement gap and opportunity gap that has been pervasive in Alexandria City Public Schools for many, many years, that the time is now to address that. You know, I think that we have talked about trying to address it. We're going to really have to do some very courageous and bold decision-making to change the narrative. And the board recently, the school board recently adopted our strategic plan 2025, and it's equity for all. And there's a focus specifically on racial equity as being the heart of all of our work. And really a lot of our achievement gap concerns and a lot of our opportunity gap issues have derived from the racial inequities that we've had in Alexandria from the beginning of time, from Alexandria Public Schools' existence. There's been a challenge with that. And I commend the board, our school board, for adopting this plan. And then two, where the work really begins is us developing action steps to address some of these achievement gap issues. We have to understand some students need more supports than others. Right? We can't just give everybody the same amount of resources. Some kids need more, some kids need less, right? Some kids need that additional push. We have to make sure that we're having, you know, opportunities like this to hear from a lot of our communities that have been underrepresented and underserved for many, many years. in Alexandria City Public Schools. And I'm the first one to admit that we have not been serving the needs of many of our families. And that's why we're doing things like this, to change that narrative and to hear the voices of the underrepresented in Alexandria City Public Schools. But our curriculum team could maybe talk a little bit more around some of the curricular decisions that are being made to address our achievement gaps, as well as our social and emotional team may talk about some of the social emotional learning that is going to occur to help remedy some of those gaps.
So I'll start with the academic side, and then we'll maybe have someone else talk about social and emotional. We have a team that has been working really over this past year to redefine our multi-tiered system of support. And what that basically means for us and for our families is that first and foremost, we want to make sure that all of our students have access to the core curriculum. And this team has been redesigning that process, and we're getting ready very soon to launch a professional development program where we really want to retrain some of our teachers and others, principals, assistant principals, and others on how to effectively use this multi-tiered system of support. What we know is that we want all of our students to have access to the core standards, right? And so, but then when they have needs and they need more attention and support, we want to be able to make sure that we have identified those resources. So a part of this system is similar to what Dr. Nickerson and Mrs. Werner just mentioned. If students have additional needs, we have actually identified more resources, particularly like she indicated, we have a course that's been defined and developed for students that need more language support, maybe more math support. This morning, I spent about an hour or so reviewing an instructional model that's being redesigned to support the needs of students with disabilities. So we're really working on making sure that we've identified those resources, we're providing more support. In addition to that, we will be introducing an assessment system that will help us identify what some of those needs are, so that teachers will be able to, whether it's in a breakout, whether it's in a pre-recorded lesson, but where teachers will be able to provide more refined and targeted support to students. I do believe that we are on a better track in the multi-tiered system of support with the way that it has been redefined on the academic side. There is a real commitment to accelerate the learning of the students. The other side of MTSS is the social emotional side, and I see Daryl smiling, so we'll maybe have Daryl talk with you a little bit about the social emotional strategies that are being unveiled.
Sure, thank you, Dr. Mozingo, and the MTSS link is a perfect segue into our discussion, because we've also taken a really hard look at how we define social, emotional, and academic learning and behavioral supports through that MTSS lens. So something that's been really present in our cross-functional planning team conversations, as well as with our principals and with our community, has been that we know we're going to need, upon a return, to have a really focused effort on social, emotional, and academic learning, and forging those really close connections between students and teachers, students and other students within their classes, as well as making sure that our home to school connections, whether or not that's hybrid or whether we're in a virtual model, remain extremely, extremely strong. So something that we're very focused on right now is making sure that there is intentional set aside time in whatever schedule we provide for explicit instruction in social, emotional, and academic learning. We want to be able to use that time to continue to do some of our community circle work that we've been doing for several years in ACPS. We also want to use that time to be able to reaffirm and reteach some of our behavioral expectations. We know that students have been out of school since March, and for many students, they're going to need some really focused opportunities to touch on and revisit what the ACPS expectations are of them within schools. We also, though, have our additional interventions that can be done behaviorally or socially emotionally with our school counselors, our school nurses, our school psychologists, and our school social workers who have remained accessible since March and will continue to do so. So if there are concerns on the part of a parent or a family about their child's needs, particularly socially, emotionally, those professionals remain engaged and connected in the buildings to be able to provide those supports and strategies and problem solve with our families to maintain those connections. And I just sort of want to close by saying we also want to make sure we're looking at all of those kinds of academic and social emotional interventions through the lens of equity that Dr. Hutchings referred to with our strategic plan. So we know that we have room to grow in these areas to make sure that all students are achieving. And our equity team under the direction of Kenitra Wood is really trying to think about how we can all learn these practices across the division to inform our work.
For that, Mr. Sampson. I do want to take one more live question before we move on to the next topic around health and safety. So this question still is dealing with instructional delivery, and the Facebook user asks, are we considering adapting the K12.com models to our virtual schools? These platforms are already well established to teach thousands of kids around the US. Why not in Alexandria? So maybe someone go for it, Dr.
So I think with the K-12 kind of models, and these are kind of like the online modules, right, for virtual learning. Really what we're trying to do is and this is going to require us to provide professional learning for our staff, because none of our staff members, I'm not going to say none, but most of our staff members were not prepared to transition into a virtual learning environment. Asynchronous learning and synchronous learning is not something that was a part of even our graduate work, as we were preparing to be educators. So it's really new for us. And we're going to have to ensure that we're providing professional learning for our staff so that they are able to deliver instruction virtually and be successful and confident while doing that. It is also going to require us to really look at how we engage our students in a very different way. I mean, I've said this, since March, that we cannot replicate our in-person experience for our students, no matter how bad we want to. And even though we know research says that in-person instruction is the best, we cannot replicate that virtually. So we're going to have to identify best practices in a virtual world. And the week prior to school, or school starting, however it starts on September 8th, we will be spending that entire week providing professional learning for our staff members. And that professional learning will continue throughout this year. So it's not just like a one-stop shop deal where it happens right before school and we don't continue, building our professional capacity. So we will continue that professional learning throughout the year. If Dr. Mozingo or Dr. Mann just could share some of the professional learning that we've already started to talk about and how we're planning to, transition our staff into this whole virtual world, which they've already been a part of. And let me just tell you, our staff did do a bang up job, from March to June. So I do commend them for all that work, but there's still more that we've learned from that, that we're going to have to, just build some more professional capacity in that area. But Dr. Mozingo?
Dr. Mann, you had an excellent model for professional learning, virtual learning with 3.0. Would you like to describe some of that? Because we're going to use some of that for 4.0.
Sure, Dr. Mozingo. We took lessons learned that we had feedback from our families in the spring that they wanted to know exactly the schedule. So when was live instruction happening? Would we have, one of the questions early on was a video where they could access to understand what their children were learning. And so we took those 2 points of feedback and worked with our student services department to also then weave in when would SEAL work or counseling work actually happen. So one of the things we did was define a schedule So if you're an elementary student, you knew at 9 o'clock you'd have live instruction for 40 minutes. Then you'd have a break. And so during that break time, that's when our teachers recorded about a 10-minute, what we would call an I do section, where that's where they're explaining to a student if they were accessing it later, or for a parent, what happened during class for the actual lesson. And then also that defined schedule said when would office hours be, when would a counselor be doing their direct services or doing an actual lesson with students. And then in our professional learning, we did more professional learning on how to record Zooms and do breakout rooms, but then also understanding what are the expectations for the online instruction and office hours, and then how do you reach out to your families, working with your special education teacher, EL teacher. And so we know we have more work to continue to do. And so one of the topics that we're looking at is what is the look and feel of online instruction, and using our MTSS framework and also our teaching and learning framework as guides, because good instruction, as Dr. Hutchins indicated, we would love to have our students back in the building. It would make all of our lives a lot easier. But there are some tried and true things that we know. Engagement, making sure that we have ways that we are circling back to get feedback from our students, that is not focusing on the 10-2 rule, that if you're going to talk for 10 minutes, that you give students or even adults at least 2 minutes time to process. So using some of our already expectations that we have, making sure that those translate to online instruction, but also making sure that teachers understand how to use breakout rooms, do feedback, and then also give feedback to students, and then also give brain breaks and a chance for students to do some independent work. And so we have our talent developer going in and looking at some of our current live instruction during summer school to see what are some pluses and minuses and other things that we can learn. And so we're planning in the the cross-functional planning teams, the professional learning teams are actually tiering our professional development. So what's something that every single person would get, and making sure that those expectations are consistent across all of our schools, so we don't have the variability we experienced in the spring.
Thank you all for answering those questions. We're going to move forward to our second topic of the day, which is health and safety. As you guys have all been doing, please continue to put questions in the Q&A box or in the Facebook chat. So a parent has asked, the priority of ACPS should be the health and well-being of students, not other factors. I have 2 children in 6th and 9th grade. Keeping them home hasn't been easy, but sending them to school is not an option. Why is ACPS even considering having children and staff in school buildings before the vaccine is available? Can ACPS really protect all the students when schools reopen?
So I can answer regarding the safety measures that we would take under either, under a hybrid model, which includes providing the appropriate PPE to include face coverings, hand sanitizer, hand soap, all of the items that encourage good hygiene and protection during this particular pandemic. We would also implement a form of, or a type of screening process for, those that are visiting on site. We would require our individuals that are either riding the bus or, coming into our facilities or participating in any ACPS sponsored events to wear the required face coverings as well. And so we are following CDC, VDOE, and Alexandria Health Department guidance and guidelines. We also have a number of health professionals that are part of our planning process that have informed some of the guidance that we are working on currently. And so, Dr. Jackson, I'm not sure if you had anything that you'd like to add to the subject as well.
Thank you so much, Dr. Hart. We understand how, frightening it can be to think about sending your child to school. And as Dr. Hart mentioned, we are working with all of our health professionals to make sure that we are putting in place things like social distancing on the bus or in the classrooms, looking at the capacity of our schools and our classrooms to be able to put as much of that guidance in place that the CDC and the Virginia Department of Health, as well as the Alexandria Health Department, is giving us to make sure that our students are safe, because it is our #1 priority, as Dr. Hutchings said. I think, you know, the cleaning of our school buildings, as well as increasing the level of cleaning, is a key factor as well in helping to stop the spread and make sure that we don't have any incidents, or lessen the likelihood of having incidents of cases of COVID. But we are preparing for our students to return to school and looking at every possible scenario to make sure that they are safe.
Thank you for answering those questions. Moving on to the next question. Since children like to play with friends and classmates, how will they remember what social distancing is? Will they be able to adhere to those regulations?
Dr. Hart, I'll start, and or Dr. Hutchings, I'm sorry, did you want to?
You can go ahead. You go ahead.
Okay.
And I'll take Dr. Hart if she needs me to.
Absolutely. So part of our protocols that we are developing in our cross-functional planning teams include what kinds of guidance signs do we need to have around the building, what kinds of practice opportunities do we need to have for our students before they enter the school buildings, what guidance do we need to have for parents as they are preparing for school. So we are looking to provide that guidance and looking to provide opportunities for our students to practice social distancing, looking for opportunities for our parents, and your support is going to be key to, before we open schools, to have some guidance for you, things that we can be working on. And we know that, you know, as you're going out to the grocery store, or as you're going out to those essential places that we all have to go, you know, practicing now with our students will be very helpful for when we return to school, whenever that is. So we definitely are looking to our families for support, and we will definitely have guidance for our teachers and other staff as we return to school.
I think one thing that's going to be important too is that, you know, this is the biggest challenge, is like, how do you teach early learners how to social distance, right? They could barely keep their hands off themselves, right? That's just how kids are. It's a part of their development. And I think that we are going to have to make sure we're just working on routines. One thing that is definitely something that we're able to do, and it's something that we've done prior to this global pandemic, is that when you have certain routines, students eventually adjust. And, you know, our kids, I think they are probably the most impressionable. We get caught in our ways as adults, right? Students, they adjust a lot faster than we do. And we're just going to have to be really creative in how we make this work, especially for our younger students. We're going to have to spend a lot more time outside, I believe, you know, because having fresh air and being out in the open and making sure that we have some sort of face coverings, I think is going to be key for us as we adjust, you know, to this new normal for all of us. But I think it is going to continue to be a challenge in regards to trying to get our youngest learners to abide by the social distancing guidelines and wearing face coverings. I think that's going to probably be one of the toughest things for us.
Thank you, Dr. Hutchings. The next question asks, if a student or teacher is sick with COVID-19, will the entire class have to go into self-quarantine for 14 days? What if the art teacher falls ill? Every single class she saw will go into quarantine. What about the PE teacher or music teacher?
So we are working with the Alexandria Health Department, and they are giving us guidance, as well as with the Virginia Department of Health, as I said, the CDC. We are taking all of the guidance, and if we have a confirmed case of COVID, we would work with the Alexandria Health Department to determine to what extent that person has had contact with others in the school building, how far and wide that contact has been. That contact tracing is very important and key and critical to us determining to what extent we need to think about a classroom, think about a grade level, think about, you know, an entire school building. So we would work with the professionals who would give us guidance and are giving us guidance, and we will have protocols in place for if this happens, here's how we support. We have school nurses. We are very fortunate to have school nurses in every building, and our school nurses are working with us right now to determine what do the school clinics need to look like, what other spaces in the building do we need to have if children are sick, if staff become ill and need to isolate for a period of time. We are also, again, going to be relying on our families to support. If your child is sick, keeping them home, what kinds of things should you be looking for? So we're looking at developing a protocol or a checklist for families. These are the things that you should be looking for. And if your child is not feeling well, please keep them home. That will be guidance that we will continue to give. That's nothing new. We continue to say that just in general, but it will be critical for us right now during this pandemic for us to work together with our families to identify when students aren't feeling well and to keep them home and to have protocols in place for if they become sick or ill at school.
So much for that, Dr. Jackson. I think before we move on to the third and final topic and theme for the afternoon, there's one more live question that we'd like to pose. This might actually go back to you, Dr. Jackson or Mr. Sampson, and it has to do with the social and emotional health of our children. One parent writes, is ACPS also considering the emotional and psychological well-being of students? Some students come from dysfunctional families and consider school as an escape and safe space.
Absolutely. I think that's been a conversation that we've been having since school closed in March. So we are looking again at trying to really embed social, emotional, and academic learning within the schedule, whatever type of schooling we look at, whether that's hybrid or whether that's virtual. And we are in conversations even today that we were having, it's really about making sure that we are establishing environments, even again, if we're virtual, where kids are excited about being there, where they feel like they have people, whether it's their classroom teacher or some of their support staff that they can talk to. And then thinking about, really trying to establish a sense of community, again, even if we're virtual, where students feel like they're part of the school and that they feel comfortable and safe in sharing things. And again, I think at any point, if students or families have concerns about that connection between their student and school, we have our school psychologists, our school nurses, our school counselors, and our school social workers who are there and ready to have those conversations to see what additional things an individual case might need to better connect that student again with their school.
Thank you.
We're going to move on to our third and final topic of today. This is a mixture of technology and community communication and engagement questions. The parent asks, the difficulty connecting to the internet and addressing Chromebook issues has been significant. Some pre-K through second students without devices weren't able to receive OT services. The Chromebook help request form wasn't in Amharic, so some families had to get a hold of the one part-time Amharic speaking parent liaison to explain the problem and to get their tech issues resolved. How will internet and Chromebook issues be addressed?
Thank you for that question. That's a great question. We have learned a lot of lessons since we got out in March, and we know that there's many things that we can do differently. Number one, because we've learned, and two, we're no longer at a stay-at-home order. So several things are going to be different. We are going to be able to help families. We're going to be able to distribute or replace Chromebooks or distribute Chromebooks and provide internet access in person rather than mailing them out. And so that will be helpful. We recognize that families need a lot of support and understanding how the technology works. They are different partners than they used to be. And so we have already started to develop more tutorials and support documents in Amharic and Arabic and Spanish as well. And we had the time to do that better this summer. We are also able now, we are going to be providing pre-K, kindergarten, first graders tablets, and we're expanding Chromebooks down to second grades. So all of our students will have a device that they can access the curriculum with, or there's really other important health services that we know our kids need and access them differently now than they did in early March. We are also working on making our tools the same across schools. So if you're a parent and have children in different grades or different schools, that you don't have to learn as many tools, that you have one place to go to find the support and understand how you can support your student. So, we're looking forward to making changes, and we appreciate the feedback, and we realize that we did not give enough on the website, on the form, the translations on those Chromebook forms, but that is in the process of being changed now.
Thank you. The next question says, how will ACPS make sure that all messaging and information about the reopening gets to all families? Even the summer learning online contract and orientation were not in Amharic. Will all reopening information be translated?
That's a great question, and that is something that we definitely are going to be doing. We had that discussion recently, and I'm going to ask for our new Chief of School and Community Relations, Julia Burgos, to comment on this. But we've been talking about making sure that all of our families, regardless of what language that they speak, that they are able to be informed around the reopening. I mean, this is a major decision that is going to impact all of our families and potentially in some families, their livelihood. So we want to make sure that they are well informed. And we've already been in discussions around just different mechanisms to inform our families, such as this. I mean, this is our first time really doing a format like this. And our community, school and community relations department has just done a phenomenal job in just being a lot more innovative. We have made a vow, and this is something that, I'm going to say it here so that it is recorded and everybody can hear it come out of my mouth to your ears. We have made a vow to ensure that all of our families are well informed. We have to go above and beyond the call of duty. There's been so much underrepresentation, especially of our families of color in Alexandria City Public Schools, that we can no longer allow to continue to happen. So we want to have other mechanisms such as videos in this language, having people, like Eden on this call. This is exceptional to have you a part of this. I mean, you're well respected in our Amharic speaking community. And we want to make sure we're doing the same for all of our other languages that are spoken within Alexandria City Public Schools. But Ms. Burgos, I don't know if there's anything you would like to add to that, just to give them a glimpse of some of our planning in regards to our communications that are going to be going out to our families.
Sure. Thank you very much. I think we're still in the planning stages, but one of the things that we are hoping to be able to accomplish, and we're still working out all the kinks on this, and hopefully we'll be able to do something like this. But we know that it's going to be difficult to be able to reach all of our families virtually. So in addition to the bilingual family liaisons that we have on staff that do a phenomenal job of doing that kind of outreach, we also want to be able to have a hotline if possible, where families could also reach out to us and we can help them continuously as we reopen schools. We want to be able to have an opportunity to connect with families in a more customer service style, making sure that they feel that they have someone to talk to and that they're not calling and that there's a phone number that's ringing and ringing this mailbox. So we're really working hard on that, and we're also looking at several materials that we're going to produce in various languages to make sure that families are are being communicated with. And there's a variety of other materials and visuals that we're going to be working on as well. We're sort of paring that down right now, and it's really going to depend on the model that that's feasible for us to open schools, for us to be able to decide on which materials and visuals we're going to actually work with. But in the meantime, we know that what's most important to us is to reach all families in whatever way that we can, and using various channels and languages, and really meeting them where they are.
Thank you. And question here says, throughout this process, parents do not want to be lectured, but they want to be heard. Families should be allowed to ask questions directly to be fair for families. How is ACPS actually engaging families in this process?
This right here is one example, right? This is one really good example of two-way communication. The questions are being asked and we're able to give responses. And we also respond to emails that come to us too. Every email that is sent to me, I respond to. And it actually comes from my account. I read all of them. That's one thing I make a vow to do. I do not have an executive assistant to read. I do have an executive assistant, but I don't ask her to read my emails and respond to them. And so I make sure that I'm engaged with our community. Then we also have other outlets. It's going to be so important for our schools to not just rely on the PTA, right? That's one form, but we have to have other mechanisms to engage our communities. And we have to reach out to some of the community organizations to help us do this. This is why we have our family and community engagement team, FACE. Like, this is the reason why that came into existence a few years ago. That's the reason why Kurt Huffman made his way here, to Alexandria City Public Schools, because we knew that there was going to be a need to engage our community. We're that focused and that intentional about it. And now that we have this whole school and community relations department that's bringing communications and our community engagement and FACE all under one roof, I mean, it is about to be like on and popping. I hate to use that expression, but I know our students use it a lot, because we're like ready to rock and roll. We are really going to be engaging all of our communities that just were not engaged before in some very innovative ways. But Kurt Huffman or Julia or Tanika, could definitely provide some more insight of just some of the innovation that is going to be happening really, really soon.
One thing that I definitely want to highlight and lift up for parents who have joined us is that there will also be 2 public hearings on August 6th and August 7th that parents can share their testimony and concerns around reopening with the board before they vote to approve a model. So what I heard from the question that Aiden read from the parent was, how would they be engaged more so around the reopening process? And Dr. Hutchings just outlined several ways that ACPS is already doing that, but these are 2 additional ways that you can, that parents can engage in the process and have their actual voices heard. Today we were reading your words, but if you want to have your voice heard, that's an option for you as well. And so we're almost out of time, but we're going to squeeze one more live question in, guys. And this one has to do with first-time learners. There was a Facebook question from families around whether or not there would be additional supports for pre-K and kindergarten students who are just starting in the school system. And if it's in a virtual model, what additional supports would there be for young learners?
And good afternoon again, and thank you for asking that question. I actually like that question. The reason why is that we actually have, in the school division, we actually have a pre-K team, a team that works on pre-K education. We have a collaboration in the community with a group of partners that are truly dedicated and committed to pre-K. We have a group of teachers that are actually writing and lessons and activities and strategies for a virtual environment. So when the decision is made, and whatever that decision might be, whether it's hybrid or virtual, we will have activities and strategies for young learners that we hope to unveil real soon. And I'm really excited about the fact that we utilized our own teachers who actually teach young children to be a part of developing these activities and strategies for our young learners. So we hope to unveil that real soon. And there will be professional development for our teachers, as well as they're looking at developing sort of a family guide. There'll be some training also for our families, so that families will be able to also support young children in a virtual environment.
Thank you so much, Dr. Mozingo.
Thank you all. And there was a comment to please have families update their contact information and preferred language. When we're talking about communication and having up-to-date information with everything going on, it's so important that everyone is updating their contact information and indicating what language they want to be communicated in. And we are at time. I want to thank everyone here, ACPS staff and our families and our community, for taking the time to come together to talk about this important topic. And please stay tuned. I know there's going to be a lot to come. So thank you all for everything. Dr. Hutchings, do you want to say anything to wrap up?
I just want to thank you all for moderating this wonderful and facilitating this discussion. I thank everybody for staying the course for the past hour and really being engaged in this. We had about 70 people on Zoom, 58 on Facebook. So that's just saying that the word has gotten out and a lot of people were engaged in this discussion, and the best is yet to come, right? Your voice is power. We want you all to continue to stay engaged with Alexandria City Public Schools, and we will do our part to make sure that we're providing you the mechanism to be able to hear from us and to have two-way communication like we've done today. So just thank you all for your time and enjoy your weekend.
Thank you. Another friendly reminder, if we didn't get to your question today, please know that we will respond to it in a frequently asked questions page on our website. So please make sure to check that later next week, and you'll see the responses posted there. Want to give another shout out to my co-moderator, Aiden, and all of our panelists, Superintendent Dr. Hutchings, for your ear and your time today. A big thank you, or amaseganalu, to our families and community members from the Habesha community who participated today. We look forward to staying engaged with you throughout this process. Have a great evening and weekend.